looks like we're at the top of the hour, so I think we'll get started. I want to just thank you all for joining us today for the Superior Health Quality Alliance Roundtable conversation. And these sessions focus on the COVID-19 vaccine and its related topics, and also the immune response that we see with the COVID-19 vaccine. My name is Jerry Henniker, and I'm joined today by my colleagues, Kelsey Ostergren and Jill Hansen. And for those of you who have been joining us for these sessions before, I want to thank you for keeping on coming back. We really enjoy having you participate in these sessions. And also, if you may be new to the call, welcome. We're glad you're here. Hopefully you'll come back for more sessions. These sessions are held each week, and they are 1-hour education sessions. And during these sessions, we highlight important topics related to COVID-19 vaccinations and their boosters. And then the sessions, after we have a formal education presentation, we follow that up with Q&A and discussion, so that we want everybody to share what maybe is happening in their facilities so that you can learn from each other. As I said, hopefully if this is your first session, you'll keep coming back and joining us each week. One thing as you're listening to this session today or in future sessions, we ask you to think about any of those pebbles in your shoes or things that you're struggling with or that you're trying to figure out. Those are things that we want to know about. And if you want, please send me or anyone else on the Superior Health team a chat message, or you can email us also. And we might add this as a future topic. We've gotten quite a few of our future topics coming from your suggestions. So please take the time to do that if you have something. Toward the end of the session today, we will put a link in chat to an evaluation. We want to hear your feedback. How can we improve these sessions? These are really important to us to know what you're thinking and how we can make these sessions better. And again, any future topics that you'd like to have us talk more about. Also, Kelsey will be putting the link to the PDF of the PowerPoint for today's session in chat. I think she maybe already has, so you can have a copy of these slides. We'd like you to use the chat today to share any of your questions or comments, or again, any other topics that you'd like to hear about. We ask that we'll be taking questions after the presentation today. So again, put your questions in chat, and then we'll have ample time for discussion and also some facilitated Q&A. With that, I'm going to turn it over to our speaker for today, Carrie Finley, and she's going to tell us more about understanding culturally and linguistically available services. The floor is yours, Carrie.
Okay, good afternoon, everyone. I'm very happy to be a part of your conversation today and share information about the CLAS standards. Displayed is what I hope that we'll accomplish at the conclusion of today. So as Jerry mentioned, my name is Carrie Finley, and I'm a registered nurse and a project specialist with the Superior Health Quality Alliance. I'm a part of our patient and family engagement team, and I'll be your presenter for today. I'm also joined by our CLAS work group members, Lindsay Roberts and Mia Coyle, who will be assisting with the presentation. From reviewing the learning objectives, we have a lot to go over today. So I'm excited to get started. So to get us started, I'd like to talk a little bit about what are the national CLAS standards. But I think it's really important before we delve deep into that we discuss what exactly does culturally and linguistically available services mean. For the purpose of this presentation, cultural competence means that organizations have a clearly defined, congruent set of values and principles and demonstrate behaviors, attitudes, policies, and practices that enable them to work effectively cross-culturally. Linguistic competence is the capacity to communicate effectively and convey information in a manner that is easily understood by diverse audiences. And this includes persons of limited English proficiency, those who have low literacy skills or are not literate, individuals with disabilities, or those who are deaf or hard of hearing. It requires for services and supports to be delivered in the preferred language or mode of delivery of the population that it's served. So to ensure that cultural and linguistic services are available, the national CLAS standards were developed. CLAS is considered essentially a set of guidelines or action steps that allows organizations to provide services that are respectful of and responsive to each person's cultural and communication needs. So how did this come about? I wanted to share just a little bit of background. Our current national CLAS standards are built upon the groundwork. It was first implemented in 2000, so 22 years ago, by the HHS Office of Minority Health. So originally the intent was to provide guidance on cultural and linguistic competency, with the ultimate goal of reducing racial and ethnic healthcare disparities. However, in 2013, the goal remained the same, but after receiving feedback from public forums, the standards were revised and are what we'll review today. The revisions have resulted in much broader guidelines and is more user-friendly. So who should use those CLAS standards? The national CLAS standards can be applied to a wide array of professions and sectors, and these organizations can include hospitals, family health centers and clinics, public health clinics, practitioners who accept Medicare or Medicaid reimbursement, mental health centers, alcohol and drug treatment facilities, extended care facilities, nursing homes, and much more. So to get a little bit into the what, the national standards for culturally and linguistically appropriate services in health and healthcare give health organizations 15 action steps for providing CLAS within the following themes: governance, leadership and workforce, communication and language assistance, and engagement, continuous improvement, and accountability. There's no single correct way to implement the national CLAS standards. An organization may decide to implement some, but not all of them, or they may wish to implement some sooner than later. The national CLAS standards provide a blueprint for healthcare organizations and providers, but again, the goal is to better serve a diverse community and can be customized to be organizational specific. So to talk a little bit more about what each individual standard and theme is, the principal standard sets the stage. It's kind of the umbrella standard. It calls on organizations to provide effective, equitable, understandable, and respectful quality of care and services that are responsive to diverse cultural, health beliefs and practices, preferred languages, health literacy, and other communication needs. So what exactly does that mean? Well, it means that we should provide a safe and welcoming environment at every point of contact that fosters an appreciation for the diversity of individuals. It can also allow organizations to meet the communication needs so that individuals can understand the healthcare and services that they are receiving and can participate effectively in their own care and make informed decisions. And finally, by meeting this standard, the end goal will be to eliminate discrimination in health and healthcare disparities. So our first theme is governance, leadership, and workforce. So to implement this CLAS standard successfully, an organization must be able to direct its attention and resources to the needs of a culturally diverse population, or plan strategically. In doing strategic planning, an organization seeks to define and structure activities, develop policies, and set goals that will empower it to provide culturally and linguistically appropriate services. So in other words, the implementation of CLAS is the responsibility of the entire system. Implementing CLAS requires the investment, support, and training of all individuals within an organization. An organization's leadership shapes the culture of the organization through its priorities, expectations, and the behavior that it models. So the standards teach us that implementing CLAS at every point of contact is critical to improve quality of care. Our second theme is communication and language assistance. This theme broadens the understanding and application of appropriate services to include all communication needs. And this also includes sign language, Braille, oral interpretation, and written translation. Our third and final theme is engagement, continuous improvement, and accountability. This theme emphasizes the importance of establishing both individual and organizational responsibility for implementing CLAS. So effective delivery of CLAS demands action across the organization. Theme 3 outlines how organizations should continually keep in touch with the communities they serve and to be aware of their clientele, the languages they speak, and the cultures they represent. And for each of these themes, as we delve a little bit deeper into the action steps, it'll become a little bit clearer in regards to the standards and guidelines. But like right now, I'd like to do a polling question. So I'll just wait a second for Kelsey to display that. So for our first polling question, we would like to know how consistently does your organization support cultural and linguistic diversity through hiring, promotion, education, and leadership policies. So I'll just give everyone a few minutes to answer that, and we can review the results. Okay, it looks like most everyone is completed, so we'll go ahead and end the poll. And then let's take a look at our results. So from the results, it appears that, we have multiple answers, which means that different organizations are at different levels or within different processes of implementing CLAS within their organization. So that's just a nice visual to review. So we'll go ahead and close that. And so that question kind of leads us into our following section of why is it important to implement the national CLAS standards. So the CLAS standards make healthcare services inclusive to all cultures and backgrounds. The goal is to eliminate health disparities and improve the health of all Americans. The CLAS standards promote cultural health beliefs, preferred languages, health literacy levels, and communication needs. They can also make your services respectful, understandable, effective, and equitable. In continuation of the past slide, the standards are proven effective. They improve engagement with patients and families and improve staff satisfaction. CLAS implementation adds value to the organization in the following ways. CLAS organizations respond to the changing demographics, which result in the elimination of disparities in the health status of people of diverse racial, ethnic, and cultural backgrounds. CLAS can also improve the quality of services that a health center provides, which can result in better health outcomes for their patients. And finally, CLAS organizations meet legislative, regulatory, and accreditation mandates, which can result in decreased liability and malpractice claims. So this leads us to the COVID-19 pandemic. So we know what the CLAS standards can do for a healthcare organization. The COVID-19 pandemic has highlighted what occurs when CLAS standards are or are not consistently implemented. There are many disparities across many marginalized groups, many of whom don't share a language or culture with their medical providers. For example, throughout the pandemic, refugee populations in the US have had worse outcomes for a variety of reasons. However, recent case studies showed that using culturally and linguistically relevant messaging alongside health literacy best practices help dispel myths about COVID-19 vaccines and help to combat misinformation in a refugee population. Another review suggested that improving health literacy through the use of culturally tailored messaging help people understand COVID-related risk information. This strategy also resulted in more behavioral mitigation strategies such as masking, hand washing, and social distancing. That said, both studies noted the importance of not just translating a message you've already created, a message that isn't culturally appropriate for a particular group. It can reduce trust in that message. So in other words, doing our homework about someone's culture will make our messaging more credible and effective. So I have another polling question for you. So we'll have that displayed. And this question asks, how consistently does your organization provide understandable, accessible healthcare related information to patients and families via multiple formats? For example, verbal, written, etc. I'll just give a few minutes, or I shouldn't say a few minutes, but a few moments. Okay, so you can see, let me end the poll because I'm just realized I can see the results, but you can't. There we go. So you can see from everyone's answers that it's pretty evenly divided in regards to the options. So this leads us to, how do organizations implement the national CLAS standards? So we have discussed each theme or section of the CLAS standards. And now I'd like to talk a little bit more about those 15 action steps that an organization can choose to implement CLAS within their organization. So as I mentioned, the principal standard sets the stage and is also the first action item. Action items 2 through 4 address governance, leadership, and workforce. So standard number 2 emphasizes that CLAS must be integrated into every aspect of the organization. So from the top down to the bottom up. We know that leadership determines whether the organization's culture will embody quality, safety, and CLAS. Standard 2 can also help provide adequate resources to support and sustain CLAS initiatives, as well as to model an appreciation and respect for all diversity, inclusiveness, and all beliefs and practices. Standard 3 has to do with recruiting, promoting, and supporting a diverse leadership team and workforce. It'll help organizations to create an environment which is culturally diverse. It allow individuals to feel welcomed and valued, as well as integrate multicultural perspectives into planning, design, and implementation of CLAS. Standard number 4 has to do with education and training. This will help organizations prepare and support a workforce that works well with diverse populations, as well as assessing the progress of staff in developing cultural, linguistic, and health literacy competencies. In theme 2, which is communication and language assistance, we address these action items, which provide guidance on how to effectively meet patient communication needs, including sign language, braille, oral interpretation, and written translation. In addition, these action items in this theme will help organizations comply with federal requirements such as Title VI of the Civil Rights Act of 1964, the American with Disabilities Act of 1990, and other relevant federal, state, and local requirements to which you may need to adhere to. So to dive deeper into theme 2, Standard 5 has to do with offering communication and language assistance, which helps an organization make sure that individuals with limited English proficiency and or other communication needs have equitable access to health services. It also assists organizations to improve patient safety and reduce medical errors related to miscommunication. Standard 6 has to do with informing individuals of the availability of language assistance services, which will help organizations inform individuals with limited English proficiency in their preferred language that language services are available to them at no cost. Standard 7 has to do with ensuring the competence of individuals providing language assistance. This will help organizations provide accurate and effective communication between individuals and providers, as well as empower individuals to be able to make informed decisions about their health. And the last standard of this theme is Standard 8, which has to do with providing easy to understand materials and signage. It will help organizations make sure that the readers of other languages and individuals of various health literacy levels are able to understand and access care. Our final theme is theme 3, which is engagement, continuous improvement, and accountability. This theme identifies the importance of establishing both individual and organizational responsibility for implementing CLAS. Effective delivery of CLAS demands actions across the organization. So this theme is going to focus on the supports necessary for the adoption, implementation, and maintenance of a culturally and linguistically appropriate policies and services. So all individuals are accountable for upholding the values and intent of the CLAS standards. What this means is everyone in the organization has a part in implementing and living the CLAS standards. So to dive a little bit deeper, Standard 9 has to do with infusing CLAS throughout the organization's planning and operations. So this will help organizations make CLAS central to the service, administrative, and supportive functions, as well as link CLAS to other organizational activities. So really this means that all of the plans that your organization is developing should be culturally and linguistically appropriate, and to make sure that your plans have CLAS within them. CLAS should not be an add-on, but a way to modify what you currently do. Standard 10 has to do with conducting organizational assessments. This will help an organization assess the performance and monitor the process in implementing the CLAS standards. Collecting information about the organization and the people it serves can be used to tailor and improve services. Standard 11 has to do with collecting and maintaining demographic data, which can help organizations accurately identify population groups within their service area, monitor individual means, access, utilization, quality of care, and outcome patterns. It may also help with outreach and community-based initiatives. So it's important that you need to know who you're doing your outreach to. And Standard 12 has to do with conducting assessments of the community health, of the health of the community. It helps an organization to determine the services and needs of the population. It can also assist with resource inventory and gap analysis of what is needed within your community. And to continue, there are 3 more standards within this theme. Standard 13 has to do with partnering with the community. It'll empower members of the community in becoming active participants in the healthcare process. Standard 14 focuses on creating a conflict and grievance resolution process that is culturally and linguistically appropriate and is open and transparent to allow for two-way communication and feedback mechanisms. And our last action item is Standard 15. And this has to do with communicating. Has to do with communicating the organization's process, which will help organizations convey information about efforts and accomplishments in meeting the national CLAS standards, as well as building and sustaining communication on CLAS priorities which will build trust between the community and the service setting. So we talked about each action item, and now I wanted to focus a little bit on ways that can be helpful with the implementation of those action items. As sometimes this task can seem a little bit overwhelming. So in this slide, we've identified 3 themes and key strategies that could be implemented to meet the CLAS standards. We'll review some of the strategies, but for the sake of time, we also have included additional strategies at the end of this presentation. So while I'll focus on 3, there are many more suggestions. So under the theme, governance, leadership, and workforce, strategies that could be utilized would be to train staff in CLAS. There are several online modules available that staff can complete about CLAS. And also I should share that the Superior Health Quality Alliance is working on a handout. It's not quite yet finalized, but this handout could be shared with staff that provides a high-level overview of why CLAS standards are important. So we'll be sure to share that once it's completed. Another strategy would be to recruit a workforce representative of the community served. Sometimes that may seem a little challenging, but a recommendation is to also bring in volunteers or visitors from a diverse cultural background, just to share their music, art, and stories of their culture, race, or ethnicity. And then another strategy would be to create and support a designated CLAS position. This may help with the implementation of CLAS strategies to have one single point person. For the theme communication and language assistance, a strategy is to offer comprehensive language assistance services. And I know that often is done. There is a recommendation to set up a third-party interpreter services or perhaps a sign language interpreter. It is recommended not to use family members as interpreters for legal documents or discuss important topics. Also, to provide a recommendation is to provide staff training on communication and language techniques for residents whose primary language is not English, including nonverbal communication training, such as sign language. It's also recommended to use interpreters that are certified, especially for key legal documents or major decisions within a patient's healthcare. And then finally, to use advanced technology for interpretation services. An example of that would be to use a website translator, which honestly, I haven't seen many examples of, or document translation. Under engagement, continuous improvement, and accountability, the first 2 strategies are all about the data. So to determine what data collection mechanisms you have and how to utilize them. And then finally, a strategy is to ensure that CLAS is integrated within your mission, vision, and strategic plans. So one of the ways to track strategies that you could utilize or to determine what is currently taking place in your organization is an implementation checklist. There is the source for an implementation checklist listed at the bottom of the slide, and it's also at the end of the presentation. But checklists are very helpful in completing an organizational assessment. This will give you an idea of what is currently occurring within your organization and the areas that can be worked on. And then just remember, there is no single correct way to implement the national CLAS standards. your organization may decide to implement some at this time and hold off on others for a later time. That is up to your organization in regards to approach. So we have I should say we have our final polling question for today. So we'll go ahead and post that. And this one is, how consistently does your organization use patient family feedback and demographic data to establish, plan, implement, and evaluate your organization's CLAS efforts? So I'll give everyone a moment to complete that. Okay, and it looks like most everyone has answered. I'll go ahead and end the poll, and then we'll share those results. So again, it looks like it's pretty consistent in regards to being in different places in regards to CLAS standards implementation. Because this leads me into discussing some additional strategies that can be used. And one of the recommendations is resident and family councils. So an important feature across themes is the need to involve communities and patients in developing an organization strategy for implementing CLAS standards. So a resident council is a practical way to obtain resident input in a variety of services such as meal planning, social activities, and policies affecting the residents. In management terms, a council might also enhance a facility by offering to residents and staff the benefits of problem solving. Using resident and family councils could also allow for residents and families to provide feedback on the development of specific programs, materials, and policies that reflect CLAS standards. I feel it's also important to discuss the correlation of CLAS standards and health literacy. Implementing CLAS standards is one strategy to improve health outcomes by accounting for the culture and language of the people an organization serves. However, it's particularly effective when it's used with other efforts, like accounting for variability in health literacy. Broadly speaking, health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. And this is actually a great time to talk about because October is Health Literacy Month. And then we'll talk a little bit more about health literacy on the next slide. But I wanted to talk a little bit about how do CLAS standards and health literacy work together. This diagram displayed gives a few examples of how individual characteristics like age, education level, culture, and language, as well as many others, can impact our ability to understand and apply health-related information. In turn, this affects our health outcomes, including the kinds of protective behaviors we engage in and our use of healthcare services. So if we can communicate with patients in ways that account for their individual characteristics and their health literacy levels, we can help these patients navigate and use the healthcare system in ways that work for them. So essentially, organizations that adopt CLAS standards and provide materials for people with lower levels of health literacy help more people access the services and the care they need. There are two important parts of health literacy: individual health literacy, which is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So this is what we covered on the previous slide. But there are many factors that impact whether someone has higher health literacy, lower health literacy, or if they're somewhere in between. This is what most people think of when discussing health literacy, and it's helpful to think of that as a state rather than a trait. So everyone can learn about and improve their skills related to finding and understanding health-related information. As we saw in the last slide, there's a lot of evidence that health literacy is related to health behaviors, health status, and health outcomes. So people with higher health literacy tend to smoke less, exercise more, report better general health, visit the ER less frequently, and perform better chronic disease self-management. The other piece of health literacy is organizational health literacy. And this is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So this can include strategies like the teach-back method when interacting with patients, as well as using plain language in patient communications. It's a good idea to structure the delivery of care as if everyone may have limited health literacy, because you cannot tell by looking at someone whether they have higher or lower health literacy. Also, higher literacy skills doesn't always mean full understanding. So for example, anxiety can reduce someone's ability to manage health information. Everyone benefits from clear communication. And then on this slide, we do have some resources and tools to promote health literacy for you. So I just wanted to go to the next slide and then I'll bounce back to this one. I just wanted to share some information about, oops, my apologies. I wanted to share information about Superior Health Connect. We would love to continue the conversation. So Superior Health Connect is a shared learning environment where participants can come together to foster and promote an all teach, all learn climate that provides the framework to improve and sustain mutual healthcare quality, quality improvement initiatives locally, regionally, nationally. And there is the link to connect, and I believe it's very easy to sign up. All you need to do is set up a username and password, and you should be able to access the information. Then I'll go back to this slide. So this is the conclusion of a presentation about CLAS. In closing, I just like to summarize that health equity is the attainment of the highest level of health for all people. So the pursuit of health equity must remain at the forefront of our efforts. CLAS is a way to improve the quality of services provided to all individuals, which will ultimately help to reduce health disparities and achieve health equity. So thank you very much. And then I think at this time, we can move into any questions that anyone may have.
Thank you, Carrie. That was a great presentation, very informative. I know Jill has some questions ready for us too, but there's one question in chat. I wasn't quite sure. It was Gray's question if it got answered. I want to first thanks Mia and the rest of the team for providing a number of resources in chat. And I know, Carrie, you have a lot of resources also listed at the end of the slide deck. But Grace's question was, do these or other resources provide suggestions for working with patients and providers with intellectual disabilities and also disseminating effective COVID-19 information? And I'm not sure, Gray, if your question got answered. So I was just going to say, if anybody, Carrie or on Carrie's team has an answer for that.
Yeah, so I can share. So the resources provided are more general resources, so they're not specific to COVID-19 information, if that answers your question, Gray.
And I did share in the chat a couple resources, one from Wisconsin Health Literacy, some of their COVID specific resources. And I think that was the impetus for Gray's question, saying, do any of these have information? And, you know, the plain language information that is generally offered in the context of health literacy tends to be more appropriate for individuals with disability, with a variety of different disabilities. However, I also shared a link specifically to some resources for individuals with disabilities and those working with them in the chat. So those links are there in the chat.
Thanks, Mia. And I see too, Grace said that I did see that you were putting resources in, Mia, but I wasn't quite sure if Gray had his question answered. But thank you though for that explanation. It's very helpful. And I was just wondering though too, I know we had a number of polling questions, and it looks like there is kind of this even divide of people who are using at least most of the time or trying to use, the class standards or documents or ways to incorporate that into their work. I was wondering if anybody on the call is willing to share either by taking themselves off mute or just putting in chat. For those of you who are you finding it, how are you finding it helpful? I think, as Carrie noted that, we see that it seems like healthcare is better provided to when you are incorporating those class standards. And I'm just wondering, if anybody wants to share their experience who is on the call today, who are using those class standards. And you can put it in chat. You don't have to talk if you don't want to. And we'll wait for people to put stuff in chat. I know, Jill, that you have some questions too that you wanted to share with the group for today's presentation. And I think you're on mute yet, chat, and Jill.
Well, good, then you didn't hear me flounder around on my question. So in looking at the polling question and the responses, what I'm curious to hear from those of you that sort of said most of the time for your responses for any of those, in terms of that class standards, is there a specific thing that you can think of that is getting in the way from you to say, we do this all of the time? So I think when we think about it, we want to put policies and procedures in place, but we also want to make sure that we've developed annual competency training for our staff. We're regularly reviewing those standards that we put in place regarding class standards. So for those of you, as I said, who answered sort of most of the time, could you share a little bit more about sort of what made you move to most of the time versus somewhat consistently? And as Jerry said, if you're camera shy or you don't want to hear your own voice, you can put it in chat.
So
Or
can you repeat
always
that?
send it to one of us directly as well, and we're happy to read it anonymously if you'd prefer that option too.
Yep. You can just send it to myself or Jill or Carrie. We're all listed, or Kelsey. Kelsey's Superior Health.
Jill, can you repeat that question? Sorry.
Yeah, no, that's okay, great. So when I look at sort of the polling responses, I'm usually looking at it from the lens of, okay, so we have some individuals that say, you know what, we definitely would really benefit from some assistance with that. So for those of you, and now that I'm sort of thinking beyond that, but for those of you that answered sort of that inconsistency, if you can share with us in the chat, yes, this is specifically what we're looking for additional learning or resources, because that helps us as a team to go, okay, great. Now we can go back and work to develop or find resources that we can then share back with you to help you on your journey to incorporate these guidelines within your organization. For those of you that have answered sort of that somewhat consistently or most of the time, what I always look for when I'm kind of reviewing those polling questions is, okay, but what is getting in the way of you moving to that next level? Because ultimately, as Carrie mentioned, we want this just to be sort of the natural way we do things within our organization. So is it inconsistent within your organization because you feel like your organization could do a better job with training of your staff? There's not enough sort of rationale for why we want to do this. And sometimes you shake your head and go, but do we really need the rationale when we know this is what we should be doing? So I think, and so the other pieces are sometimes leadership will say, this is what we're going to do without providing a lot of context back to staff, and that they struggle with how to engage with that. And the other pieces too, they may not have been involved in as much and understand the importance of being able to communicate effectively with our residents to allow them to receive the best care possible.
And I think, Jill, just to kind of dovetail off of that, I think, if there are specific things that we at Superior Health could do to help you move from part of the time, some of the time, to, yes, we do this 98% of the time or better, right? What would those things be? You're the ones that are closest to this. You live this every day. So if there are specific things that you're struggling with, probably others are as well. So, I think that's sort of the background, if you will, on why we're looking for that. Is there something additional we can do to support you in this journey?
And Kelsey, I'm going to dovetail on yours. And for those that answered that they are doing it, because we did have those who are saying that they're doing it consistently all the time, I'm sure you had barriers you had to overcome too. And since we're trying to learn from each other here, certainly would love to learn what it was, how you overcame some of those barriers. I'm thinking, is it because of staff turnover that it's hard to get this incorporated because you constantly have to retrain staff? What did you put in place to overcome that barrier?
And Jerry, I was just going to share that, a first step would be to do an organizational assessment, whether it's the one that I resourced or there's other assessments available if you do a search. But I think would be an excellent starting point just to kind of gauge where you're at. I mean, some of what you discover may be very surprising. I think it's important to ask not only staff members, but also, residents as well, to get a full picture of where your organization is at.
Carrie, I'm going to put you on the spot. So you mentioned sort of completing that organizational assessment to identify sort of the gaps in your areas of opportunity within your organization. What if I'm a nursing home and I'm just, okay, we did the survey and now what? How do I move forward? Can I reach back out to you, Carrie? To find out like how to move forward?
Yes, no, I think myself or anyone within our class work group team would be more than happy to help. I think as far as now what, to look to those quick wins. I mentioned that, there's 15 action steps. It may not make sense to work on all 15, or perhaps to target, 2 from each theme would be realistic for your organization in regards to what you would like to focus on.
And I will add that we are, from Superior Health, we're going to be continuing to push out more materials on the CLAS standards. So sort of more to come in terms of what next. And I think any input that we can get from our participants will help us make sure that those materials are as effective and as sort of on the spot of where you need it as possible. And then the other thing I wanted to add, sort of in response to your question, Jill, if you do an assessment or even just informally look around and realize you have spaces to go to grow, that might be the perfect thing to post on Superior Health. And I'm sure you'll get a wealth of Superior Health staff chiming in, but also, some input from other participants across across Superior Health, some of our other, a nursing home in another state may chime in and say, well, this is where we started. And that would be the perfect thing to post on that Superior Health to get some input as well.
Well, that's a great suggestion, Mia. The other thing I was going to say too is sort of piggybacking off of Carrie's response with, sometimes when we do those organizational assessments, it's a little bit overwhelming when we get the results back. So I think, as Carrie mentioned too, you can look internally, think about the quality initiatives that your organization is focused on. If you have, and most organizations sort of have their top strategic goals for the year, also see how those could align with the work that you're already doing. So rather than it feeling like, oh my gosh, it's something new we have to focus on in addition to everything else, try to find ways to weave this into the work that you're already doing, because the reality is you probably already are touching on this. It's just really a matter of shoring up how you're doing this and how consistent you are doing this with all of your residents and staff.
So I'm just looking, I'm not seeing anything, new questions in chat. Quiet group today.
So Jerry, I've got one more question.
Oh, sure. Go ahead. Jill.
So I know we talk about sort of the piece around sort of ensuring that sort of our residents are provided the ultimate optimal care, regardless of, their cultural or linguistic background. What I'm wondering is, has your organization sort of promoted the cultural heritage with your residents and sort of shown a spotlight within and allows, I think Carrie's presentation talked about, having conversations with residents just to learn more sort of what's their history. And I'm curious to know if your organization is able to do some sort of promotion within that, so that it's sort of that education opportunity for everybody within the nursing home to learn a little bit more, not only about that resident, but also about sort of that cultural history. So feel free to put it in chat if you don't want to come off of mute.
I say that's a great question, Jill. Give people just a few minutes because I know they're typing their responses in chat right now. As you're doing that too for the group, I was going to say, Kelsey did put in chat also the link to our feedback form. We love to get your feedback, find out, what type, feedback on not only on today's session, but what other things you want to hear about. So please take a minute to, it only takes a few minutes to answer the brief questions on that link to that evaluation. So I'm just curious because, I'm not hearing a lot of conversation from the group, and that's fine. But I'm just wondering, because I know that people are using this because we saw that in the polling questions. Just it'd be great to hear from you. And again, you can put this in the evaluation link too, if you prefer to do it that way. Just kind of, how from Jill's questions, but just again, how you're using these standards, how you're incorporating them in your organization, how you're benefiting from them, but what the barriers are. We'd love to hear that because, as Kelsey was saying too, and as Mia was saying, we're developing documents and resources all the time. So it helps us to develop those when we can get your feedback. Jill, I just wanted to check with you. Did you have any other questions for today's presentation that you wanted to share?
Other than I was just going to say, just a reminder with any policy, I'm sure this probably isn't a surprise for you, but, just make sure that when you're reviewing, you sort of have a timetable for reviewing your policies. And if you have any sort of evidence base tied to those policies within your organization, just make sure that you're sort of doing a review to see if anything more current in terms of that evidence component comes in. I think sometimes we put policies in place and we may forget to add sort of that check step to say, is this still relevant, or has something changed within our organization that would warrant us to update this?
Great question, Jill. And I just want to check too to make sure. I know Carrie had a number of her team members on the call today. If there was any other comments or questions that any of her teammates wanted to share.
I just wanted to say, oh, yep. I believe I've covered everything that I want to share. Just if I could say one thing, my presentation today, was very condensed within the time frame. CLAS is something that, takes some time to kind of pick through and get a good understanding of the standards and the action steps. So like we said, we'll have more materials forthcoming, and we'd welcome any questions, like any way that we can assist. We certainly would do that.
Thanks, Carrie. I just wanted to thank you for presenting today and for all of your team members. I know I helped put the presentation together. Thank you all. Again, if you think of questions afterwards, Carrie's email is up there. You can shoot her a question. Again, click on the link to fill out the evaluation for today to provide us with feedback. And with that, I'm going to close out today's session. We will see you again, same time, same place next week. And you know what, Kelsey, can you help me out? I do not have the topic for next week's session on the tip of my tongue. Sorry about that.
That's okay. So we are going to be doing a little bit of motivational interviewing, specific about co-administration of our updated COVID boosters and our annual flu vaccines.
Thanks, Kelsey. I should have remembered that. Thank you so much, though. So see you next week for motivational interviewing. And again, if you have any questions, you can shoot Carrie specific to today's session, but otherwise feel free to reach out to either Kelsey or myself or Jill. Thank you. Have a good day.